Today, we're going to pull back the curtain on something you probably think you know all about, your massage. Welcome to The Explainer. We all love that feeling of deep relaxation, right? The knots in our shoulders finally melting away. But while you're blissfully zoning out, there's a whole hidden world of science, safety, and public health happening all around you, one you probably never even notice. You see, while your focus is totally on your personal health, that amazing feeling of relief, your therapist is also operating as a guardian of public health. They're protecting not just you, but the entire community. And honestly, understanding that role, it changes everything. Okay, so let's dive into this. Before a single drop of oil is even used, your therapist is already at work, kind of like a health detective on the front lines. Their whole investigation really starts with a deep understanding of pathology, which is just the science of what can go wrong in the body. Now, this isn't about diagnosing you. Not at all. It's about recognizing patterns and potential risks to keep absolutely everyone safe. And this is exactly where that knowledge becomes a super critical public health tool. A therapist is trained to spot these really subtle differences between skin conditions. Is that red patch just harmless eczema that they can work around? Or is it maybe ringworm, a contagious fungal infection that means the session has to stop right then and there to prevent it from spreading? Knowing the difference is a massive public health skill. And trust me, they're looking for way more than just skin conditions. Things like a chronic cough, if you've been in the hospital recently, or signs of a respiratory virus. Those are all red flags. And again, let's be super clear. They are not making a diagnosis. They are trained to recognize when the safest, most responsible thing to do is to stop and refer you to a doctor. This protects you, it protects the therapist, and it protects every single client who walks through that door. So how does all this detective work actually protect the whole community? Well, it really all comes down to one core concept: breaking the chain of infection. Every single infection, whether it's the common cold or something way more serious, follows this exact sequence. It's called the chain of infection. And for a germ to spread, all 6 of these links have to be connected. So what's the key to stopping it? You just have to break one link, any link. And this is where your therapist's training becomes absolutely essential. Let's make this real for a second. Think about something as simple as a shared lotion bottle. In this chain of infection, that bottle becomes a perfect reservoir, a place for germs to just live and wait. If someone touches it with unwashed hands, it can then become the mode of transmission to the very next person. See? One simple object, 2 links in the chain, just like that. And the solution? It's just as practical. By meticulously, and I mean meticulously, disinfecting every single surface, the table, the face cradle, doorknobs, and, that lotion bottle, between every single client, the therapist breaks the chain. The reservoir gets eliminated, the mode of transmission is blocked, the infection is stopped before it can even think about starting. So, here's the crucial point. These small, deliberate actions that happen in one little treatment room have a much, much bigger impact on the health of our entire community. Your therapist isn't just acting alone, making up their own rules. Nope, they're part of a huge, interconnected public health system. They're following federal guidelines on things like PPE during a pandemic, they're following provincial standards on hygiene from their regulatory college, and they're paying attention to local alerts about flu outbreaks. They are a vital endpoint in a national health strategy. But infection control, that's only half the story of public health. The other, much larger half is all about chronic disease. In Canada, a staggering 89% of all deaths are from non-infectious conditions. We're talking about things like heart disease, diabetes, and mental health disorders. And this is why wellness services matter so much on a public health scale. By helping people manage chronic pain, reduce their stress, and just improve their quality of life, therapists play a crucial role in health promotion and disease prevention. They help ease the immense burden that these chronic conditions place on our entire healthcare system. So all of this leads to this really powerful reframing of who your massage therapist really is. They're not just some service provider. They are a regulated health professional in your corner. Have you ever noticed they call you a client and not a patient? Well, that's a very deliberate choice. The term patient kind of implies a medical diagnosis is happening, but client reinforces a collaborative professional relationship. They're providing care with you, within their very specific scope of practice, not prescribing treatment to you. It's a key difference. As the author of our source material, who is both a doctor and a registered massage therapist, puts it so well, they are true frontline guardians of health. They operate right at that unique intersection, blending that personal, hands-on care we all love, with the much broader, often invisible mission of keeping everyone healthy. So, the next time you're on that table, take a look around. You'll see the clean surfaces, the careful procedures, the professional way they communicate, and you'll know. You'll know it's not just for your relaxation. It's part of a deep and powerful commitment to your health and to the health of everyone around you.